In this clinical scenario, we have a 19-year-old female with extremely long, heavy periods. Now let's define that. That's bleeding that lasts more than 7 days, bleeding that soaks through one or more tampons or pads every hour for several hours in a row, needing to wear more than one pad at a time to control menstrual flow, needing to change pads or tampons during the night, menstrual flow with blood clots that are as big as a quarter or even larger. So this patient has extremely long, heavy periods, as we discuss what the definition is. Bleeds after brushing teeth, okay? Bleeds after brushing teeth, which we examine this patient. She doesn't have poor dentation. Sometimes we have to look at that. Extremely poor dentation, you'll bleed after brushing teeth. Infrequent nosebleeds. So what does this patient have? So the answer to the clinical scenario is a 19-year-old female had von Willebrand's disease. And so what is von Willebrand's disease? It's caused by quantitative or qualitative defects in the von Willebrand factor. That's a large multimeric glycoprotein essential for hemostasis. It's inherited in an autosomal pattern, so it affects both male and female equally. But women more commonly seek medical attention due to the GYN bleeding. Now you can also have mucocutaneous bleeding, which is epistaxis, easy bleeding from minor wounds, heavy menstrual bleeding, which we talked about, excessive bleeding after dental work. So that can be a diagnosis sometimes. You can always ask patients, hey, when you had your wisdom, if you had your wisdom teeth removed, did your surgeon and or dentist say that you were bleeding very heavily? Also noted for heavy bleeding after surgeries and or childbirth. What is von Willebrand's factor? Now, von Willebrand's factor acts as a bridging molecule for normal platelet adhesion and aggregation as a carrier for factor VIII in the circulation, increasing the half-life of factor VIII. I want you to think von Willebrand's factor and factor VIII as being cousins. They just hang to each other. They're close cousins that hang with each other. So these are very important. Von Willebrand factor is a cousin with factor VIII. They hang with each other. They increase the half-life. Von Willebrand factor increase the half-life of factor VIII. Very important. Now, von Willebrand's disease, as we discuss, is a defect in von Willebrand's factor. And it's the most common inherited bleeding disorder in the United States. It affects about 1% of the population, so greater than 3 million people in the United States alone. Now let's talk about the different types of von Willebrand's disease. Type 1 is the most common. So there's rare, where there's various rare defects. These are 1 in a millions. Type 2, where it's qualitative. It just doesn't work right. The von Willebrand factor just doesn't work right. Type 3, where there's near or total absence. Now, type 1 is the most common, and it's about 70 to 80% of the cases. It's a quantitative defect, less von Willebrand factors, but it works. Okay, this is the most frequent, less von Willebrand factor, but it works. So when does von Willebrand's disease occur or manifest? So we have a primary deficiency or defect in von Willebrand factor, and this is contributed with low levels of factor VIII, and we'll talk why this occurs. Von Willebrand factor carries and protects factor VIII in the blood. So a von Willebrand factor problem often leads to lower factor VIII levels. Okay, they're a team, they work together. So in normal hemostasis, inside the blood vessel, we have functional von Willebrand factor, and it works. And it gets together with its cousin factor VIII. They go hand in hand together, and they do a great job, and they form a platelet plug and fiber and clot. Now, if in impaired homeostasis, we have a deficiency or defect in von Willebrand factor. We talked about 1, 2, and 3. And we have a dysfunctional or low levels or no levels of von Willebrand factor, and we have reduced platelet adhesion, weak delayed clot, and you have bleeding symptoms. Now, remember, von Willebrand factor protects and carries his cousin factor VIII. Okay, so then you have reduced factor VIII, and you have unstable rapid clearance due to insufficient von Willebrand carrier, and you have impaired fiber and clot. So they work together as a team, but if they're not together as a team or there's reduced factor VIII, they are not going to control the bleeding symptoms. So who gets von Willebrand's disease? Both men and women both get it, but because women will present with menorrhagia, they're going to come to the providers more often. So let's go again and discuss what is heavy bleeding, because that's so important. Bleeding that lasts more than 7 days, bleeding that soaks through one or more tampons or pads an hour for several hours in a row, need to wear more than one pad at a time to control menstrual flow, need to change pads or tampons during the night. Menstrual flow blood clots are as big as a quarter or larger. Remember, about 10 to 30% of women with menorrhagia will have von Willebrand's disease. So this is important when you're taking care of your patients to think about. Let's talk about the treatment of von Willebrand's disease. Now, remember is that the treatment for von Willebrand's disease, it's an individualist approach. So it's going to be based on the disease subtype, the disease phenotype, and clinical context. Now, desmopressin can be used because what does it do? It induces endothelial release of stored von Willebrand factor and factor VIII, the two cousins that work together. Now, this won't work for someone who has von Willebrand's disease type 3 because why? They have none. They're not producing any, so they're not going to release anything. In these type of patients, you would need von Willebrand factor concentrates. And there are some patients where desmopressin doesn't work or is ineffective, or they just cannot use it due to their subtype. Now let's talk specifically about treatment for poor women who have very heavy menses or menorrhagia, which can be treated with tranexamic acid or aminocaproic acid. Now these, if you as a clinical point, if you're doing a lot of procedures, maybe you're doing central lines, is some places will have a liquid form and you can put on a sterile gauze and put it at the site. Sometimes that does help stop bleeding. Now let's go back to our clinical context of this case with this 19-year-old female with heavy menses. So it can be used and inhibits, so tranexamic acid and aminocaproic acid, they inhibit the lysis of fibrin and it blocks plasmid during menses. So it reduces bleeding for these poor women who have horrible menorrhagia.